I'm Polly Mann, and I'm here this morning with the Peace Troupe. That's T-R-O-U-P-E, meaning a dramatic troupe from Women Against Military Madness. And we're talking to people about health care and the lack of health care that's affordable by the majority of the American people, and its connection to the military budget, which goes on and on and on. Thank you.
Being young, I guess I'm satisfied now. For the future, I think I'm worried.
Me personally, I'm absolutely against wars. I hate wars.
Like I said, my husband and I, when I got laid off, couldn't afford to pay the health insurance premiums.
I haven't had health care probably since 1989, since I moved back to Minnesota.
Ideally, like to see some kind of health care that covers everyone in the United States.
I would say it's too expensive, it's too complicated, it's too dependent on having a job.
But I don't want to pay for anybody that chooses not to have insurance and is gainfully employed.
And he's also had prostate cancer, so at this rate, she has to provide to him because he's got a pre-existing condition.
We need a little more on health care, yeah.
And what's being brought into the debate is the huge amounts of money that are being paid, that are being contributed to the various members of Congress by the health insurance industry and the pharmaceuticals.
Yeah.
And those people just end up on the committees that make the choice.
Yeah.
And they are the people that are saying that our health care is fine.
How is there an unlimited amount of funds for the military, yet things domestically we seem to get taxed for?
Yes, exactly.
So
Well, that's
where does all the money? I just don't get it.
I'm Dan from Minneapolis. I got a brother who's a Vietnam vet, has Agent Orange cancer, and he, without medical, he wouldn't make it. You know, he's got to have his medical. He had a second stroke here just last week, and they told him that it was more than likely his last one.
Yes. What is your name?
Eric Robinson.
Health care plan that pays when you get ill?
Yeah, at the moment, yes.
Well, that's good. That's good. So,
They talking about cutting it out, though.
what?
They talking about cutting it out next year.
Most of us want here, which is a single-payer, universal plan that would cover everybody from the time they're born to the time they die, that's unconnected to their work. How would you feel about this kind of a plan?
You know, I think that if it's done correctly, it's a great idea.
Well,
That way, when we go through cycles like we've gone through,
yes,
and
right.
a lot of people are still going through, you still have that protection, and perhaps, I'm not sure how they would work it out. I still think you probably will have to pay something for it, and be it higher taxes, or if we have to pay some kind of premium.
And underemployed, and and it's not my job skills, and they admit that. So it's not anything that I'm really doing on the job, but I'm not 20 years old anymore,
Huge amounts of money that they could put into healthcare.
Yeah, they could put it a lot of other places besides we don't need that war overseas right now, I really don't believe that we do.
Trillions of dollars.
Yeah. What is your name?
Gregory Ware.
Gregory?
Yeah.
My name is Polly Gregory. Nice to meet you. Has there been a period in your life when you haven't had health care?
Several.
Several.
And it's very bad because they expect you to come up with the money out of pocket, and of course you don't have it.
Exactly. So what would you recommend for the public at large? What would you like to see ideally?
I ideally like to see some kind of health care that covers everyone in the United States, period.
Unconnected to work?
Unconnected to work, unconnected to anything other than the fact that you're alive and you're human.
Well, I think those of us would agree with that. Many industrialized countries in the
We're
world.
one of the few countries that doesn't cover the three majors, either
Right.
housing, schooling, or health.
Yes, right.
And we don't.
So what's your first name?
Dan,
Dan, what city are you from?
St. Paul.
St. Paul?
Geez, probably 15 or more years ago when I didn't have health insurance and I had a kidney stone, and $2,000 or $3,000 later, that's what I had to pay for basically just being told I had a kidney stone, and there's not a whole heck of a lot we can do about it. So yeah, it's very stressful not having health insurance. I do think military power should be used very sparingly. I don't think we can just drop out of the wars we're in.
Those people have to take on personal responsibility.
And well, that's a very interesting point of view, especially having been covered at a prior time, because there's
Well,
about
I was able to get insurance through the state of Minnesota. We have an outstanding plan here for people who are uninsurable, and I don't know why we can't adapt that in other states.
what do you attribute to the 50 million or 47 million, I think it is, of people that lack insurance coverage right now?
Have you seen the numbers of the percentage of people who choose not to have it and desire not to pay it? It's almost 40 to 50%. I was recently in the emergency room. There were 4 people ahead of me. Not one of them had health insurance. I'm the only stupid one that's paying the high premiums, and I had to wait for the other 3.
About $180 for catastrophic care, which just covers in case anything horrible happens to me, and that way my family won't, lose their house, or my parents won't lose their house paying for, catastrophic surgery or something.
Actually, I'm quite satisfied with Blue Cross Blue Shield.
Well, that's your supplementary, isn't it?
Oh, that's our regular health
Your regular.
plan.
Okay.
So,
You feel it's expensive?
yeah, it's kind of expensive. Yeah. So yeah, probably too much military spending right now.
And more on health.
We need a little more on health care. Yeah.
Thank you so much. Now.